Welcome back to Pink Ribbon Roller Coaster. I'm your host, Jennifer Harrod. Breast cancer treatment can affect nearly every system in the body, including the mouth. Today, we're talking about why dental care is an important part of cancer care and what patients should know before, during, and after treatment. To discuss oral health during cancer, I am joined by the founders of Uncancer. Dr. I'm going to pronounce this wrong. Abida Tahir is an MD, PhD, board certified oncologist. Dr. Robin Lesser is a DMD, board certified pediatric dentist. And Shayna Kligerman is a survivor and the director of outreach and community partnerships at Uncancer. Thank you, ladies, so much for joining us today.
Thank you for
Thank
having
you.
us.
Yes, yes. For listeners who may not be familiar with Uncancer, what is the mission behind the organization?
I'll take that. I'm the founder and CEO. One thing to clarify is I'm not a medical oncologist, I'm an oncoradiologist
Oh,
by
I
profession.
apologize.
No, not at all. I just wanted to make sure the audience knows that Uncancer was actually born just from a desire to help patients navigate the cancer journey through treatment and through survivorship, to have sort of a reliable friend that they could ask questions at 2 a.m. in the morning when they're worried or their caregiver is worried, and actually be able to trust the answers, trust the support, and feel like they have someone they can rely on as they go through this journey. We're about 3 or 4 years old now. Robin, my co founder, is a pediatric dentist, and really we came together um, to ease that journey for cancer patients.
That's great. Very much needed. So, really, was there a personal story of experience that really started all of this?
I'll let
Well,
Robin take that.
okay. I think Abida and I are always talking. We've been friends for years. Our girls have been friends since they're in kindergarten. They're going off to college next year. So during COVID, when we couldn't work, we would meet with the girls in a park outside and this, and have a really a nice chance to have meaningful conversations that we typically don't get to have when they're around, just because we're busy and they were getting older, so it was a little easier. And we felt like there was a lot that was not that was missed in the office of the oncologist or the radiation oncologist, because there are other patients, they have limited amount of time, and we felt that there was this need to kind of fill that void. And so Abida started writing blogs as ways to help people and find out information and things that typically don't come up when you're in the doctor's office. And over the years, just through my profession, when friends, family like Shayna were going through treatment, I would put together care packages of different products, help them maintain or help manage their oral side effects. We started talking, and Abida asked me what my favorite products were that I was recommending. And we found that there was a lack of availability. You couldn't get everything in one store. Some products that we thought were great were being discontinued. And we just felt like we couldn't put together our favorite desired products or our wish lists that we would want friends and family to have. So with having time on our hands, we were able to find manufacturers and we formulated them. Avida's background is actually a PhD in biochemistry as well. So it's nice to have that. So I knew what we wanted. She knows what we need to put in for it to do that. And we made these products. We've tested them in vivo, in vitro, proven to work. And we felt like it allowed us the opportunity to provide to anybody what we would for friends and family. And I really feel that's where the product side of the company came from, was just our desire to make things easier and have it all available on one site.
Wow, that's amazing.
So,
Well, thank you. So, Shayna, I understand you're a survivor. So, how did you get involved with Uncancer? Do you have a personal meaning to you that brought you to Uncancer?
I do. I do. Well, I have known Robin since we were kids. We grew up together.
mhm.
And I also worked with her in her dental practice. And at the end of 2016, I was diagnosed with breast cancer. So of course she was right there to help me with some things as far as, oral care was concerned. She was checking my teeth, every month, making sure, recommending products, and really helped me through with very minimal side effects. So in 2020, when the two of them came up with this idea, I said, I have to be a part of it. It's something obviously I'm so passionate about, but also something I just don't think is discussed enough with cancer patients, how important dentistry is with oncology. And I don't think an oncologist ever specifically mentioned to me, you need to go to the dentist or you need to do this. I mean, it may have been on a piece of paper or something, but I've enjoyed being a part of this because I'm able to, spread that to other patients and survivors, about the importance of it. I've heard too many times people being told not to go to the dentist or avoid cleanings and avoid this and that, and I'm happy to debunk those myths and really help. You know, Guide patients and have them go to our website and look at the checklists that we have on there that are great for patients when they're going to the dentist and going to the oncologist, and read the blogs and use the products, because I can't tell you how much I wish I had them when I was going through my treatment, because they're so fantastic. So I believe in them and I believe in the company, and that's why I'm a part of it.
Wow. And I think, you brought up a good point. I think so many people don't realize that breast health treatments can affect
Mm.
oral health. So,
Absolutely.
Dr. Lesser, can you explain why the mouth is impacted during cancer treatment?
Well, all the cells in your mouth and your mucosa are rapid turnover cells. So that's what chemotherapy, immunotherapy targets. Those cancer cells are rapid turnover. So while you're destroying your cancer cells, you're also destroying those cells in your mouth. So we're seeing an increase in mucositis, stomatitis, dry mouth, sensitive teeth. So we want to help repair those cells so they maintain a level of health and staticness, so somebody doesn't suffer from malnutrition or have to delay treatment because they are in so much pain.
Okay, thank you. Dr. Tahir, what types of treatments really tend to affect oral health the most?
So, it's so surprising, and people don't realize this, is that, of course, if you have a head and neck cancer, right? So, if your cancer is located anywhere in your head and neck area or even in your upper chest, and you get radiation will definitely affect your oral cavity, right? It'll dry out your salivary glands. It'll impact your teeth, your the lining of your mouth, and cause all of the side effects that Robin spoke about. But we look at breast cancer, for example, and about 60% of all breast cancer patients will have oral side effects. Similarly, for lung cancer, for colon cancer, there are so many different types of chemotherapies that impact the oral cavity as well. And what we don't realize is that, when a patient is undergoing cancer treatment, such a vulnerable time in their lives, they're just grateful to get the treatment and be alive and be a survivor at the end of the journey, that things like that affect the oral mucosa somehow seem sort of not as important as the cancer that's probably growing or in their breast or in their lung or in their colon. And we tend to minimize those side effects, but honestly they impact the life so much, right? If you're not able to eat, you're not able to drink, you're not able to speak very well, right? Because you don't have any saliva in the mouth and your mouth is dry. It impacts your survivorship. It impacts that treatment journey. And really, the downstream cascade effects are as important as your response to the treatment at the site of cancer. So it's not just within head and neck cancers, but nearly every single cancer treatment, or even medications, right? If you're on medications for depression, medications for sleep, for hypertension or high blood pressure, all of that have side effects. And one of the major side effects is dry mouth. So, really, there are a host of things that impact your oral cavity that we tend to sort of minimize, but we really shouldn't, because it really impacts your quality of life, the way you respond to treatment, and through survivorship.
Wow. And I didn't know that about the different medications either.
Mhm.
So that's great information. Um, what are some of the most, I know you briefly touched on it, Dr. Lesser, but what are some of the most common oral health issues breast cancer patients experience?
Well, because of the change in saliva, your saliva naturally bathes your teeth. It helps remineralize and keep your enamel strong. So when you have that dehydration and change in saliva, and also it can become more acidic, you're more prone to developing decay. You're more prone to developing sensitive teeth. Also, ulcerations in the mouth, mucositis, stomatitis, sores. Um, and also you can get angular colitis, which are the cracks in the corners of your mouth where it gets dry, and you can get those very sensitive, tender areas, and it can actually be an open wound, can occur as well. So they kind of all tie together with the change in saliva flow, cell turnover rates, and it's a whole environment that where one thing changes, it kind of cascades and affects other side effects and can amplify them as well.
Wow. Are there symptoms that patients need to watch for that might indicate that they need to see a dentist right away?
Well, we actually recommend seeing your dentist before you even start treatment. You need to go have taken care of any issues that may arise when you start, because we know that this is a common side effect for everybody, no matter what type of cancer they have. So if you have any small restorative needs, fillings, things like that, you have teeth that are not salvageable, you need to go ahead and have those extracted before, because you're also going to be more prone to infection. So if you have a tooth that's about to abscess or you have issues with that, it's only going to get worse. So we recommend seeing your dentist before you even start treatment. There's always that little window of time from diagnosis, and work with your dental and oncology team together. And that's something where we feel that there's been a lack. I feel like for cardiology patients, there's a really well-known standard line of communication form. So we've actually developed those to help your oncology and dental team work together so there isn't a disruption in treatment. Or if something arises, your dentist will know your white blood cell counter, if you're more prone to infection or bleeding, if we can proceed with an extraction. So we really need everybody to be on the same page and to work together through your treatment. So my best advice would be, as soon as you're diagnosed, go see your dentist.
Great advice. And I know there's probably some daily habits that patients can adapt to really protect their oral health during treatment. What are some of those daily habits?
Correct. So you want to maintain your hygiene. You want to floss. You want to brush at least twice a day. Because your mouth is a little bit drier, you want to make sure you have a mouth rinse that doesn't contain alcohol, which can dehydrate your oral tissue and mucosa even more and contribute to those side effects. Drinking water throughout the day, maintaining a neutral pH, because the drier your mouth is, and if you're eating sugar candies to help stimulate saliva flow, you're only going to make that worse, because the sugar increase feeds the bacteria that causes the decay, and it produces a more acidic environment. So it's very cyclical. So you want to make sure you're practicing cavity prevention, prescription strength toothpaste, hydroxyapatite toothpaste, depending on your oral needs, seeing your dentist. Um, but really just maintaining basic oral care and maintaining that hydration of the mouth and the tissue in the mouth itself.
Great. Now, I know there are some products that Uncancer has on their website that I'm excited to
Me
hear
too.
about. So, because I know there's specific mouth rinses and products that patients should use, they should avoid. So, can you tell me about some of the oral care products that Uncancer has?
Yes. So we have our soothing mouth rinse, which is actually more alkaline. So it has a pH of 10 to 10.5. You just rinse and spit with that throughout the day. Shayna's holding it up now. They come in stick packs, and you can just put them in a 32-ounce water bottle. So you're neutralizing your saliva and hydrating your tissue, your mucosa. So it stays nice and moist, and you're reducing your risk of decay that way. We have a remineralization gel pen that has calcium phosphate in it and potassium nitrate. And that helps with a lot of patients when their mouth is dry and they develop sensitive teeth. It almost feels like a zing from the inside of the tooth, like an electrical shock. That really helps with that. So you can just paint it on your teeth. We have an amazing nanohydroxyapatite toothpaste that's 10% nanohydroxyapatite, and it's a rod shape because over 97% or 95% of your enamel is made up of hydroxyapatite. We're putting those minerals back into the tooth and strengthening it. So not only are you helping remineralize or strengthen your enamel, you're also reducing your sensitivity by helping with that as well. We have a lip balm that helps with the dry, cracked lips. I feel like I'm forgetting something. We have a bamboo toothbrush. What am I forgetting? Our candies.
The other thing to realize is that all of our products are actually based on the recommendations from the National Cancer Institute, from MASCC, from ASCO. So all of the organizations that actually track and make sure that you're getting the right standard of care recommend these products. And we always wanted to be, in that lane where there was clinical evidence that this works and that it's right for the patient, and that the patient can take them without any concern or having to question, where these products came from. Our products are made in the US. They are all CGMP certified factories. We have certifications. We do all of that stuff just because we know how important it is for cancer patients to feel that level of comfort that anything that they're putting in their mouth or taking is right for them and helps them go through treatment. Yeah.
Wow. And I feel like these could be beneficial even if you're not going through treatment. They sound amazing.
Absolutely. I mean, all our family members use it. We make our kids use it. We make, our spouses use it, and they love it. My husband has really sensitive teeth, and he said he has never found a toothpaste that actually yeah, that actually helps him with that teeth sensitivity and doesn't create that chalky or that dry feeling. Sometimes when you take toothpaste that are sort of for sensitive teeth, they have that chalkiness, but ours really is sort of so easy to use, and it's so good that you just smear it on your teeth and you can go to bed. You don't even have to rinse out. So really a lot of stuff that is very thoughtful and intentional for patients. Yeah.
That's
When I
great.
was going through my treatment, it was very difficult to find a toothpaste that just felt gentle and mild, and it still has that mint flavor, but it's like Dr. Lesser or Robin was saying about the spicy or that zing. You don't get that at all. And I had that with other toothpaste that I was trying, and it's this one is fantastic and gentle and tastes good too.
Wow. Such thought that's gone into all of these. I love it. And I can't wait to share it with everybody. So thank you. Um, I know for breast cancer survivors, there's long term oral health effects that they should be aware of. Do you mind explaining a little bit about these or?
Yeah, sure. So, and not just breast cancer, right? Everybody knows somebody who has cancer, right? 1 in 8 women are going to get breast cancer in their lifetime. There are similar numbers for lung cancer, for prostate, for men, for colon cancer, which we're seeing so much more in young people as well, right? And imagine if you're in your late 30s or in your 40s, you're just, sort of peaking in your career. You're starting a family, you have a friend circle, you have, a social circle, and you're trying to manage and navigate all of that while still undergoing treatment. Right. So, a lot. and for breast cancer patients especially, right? You have kids and you have a job, and then you may have other things going on in your life, and treatment may last for 2 years or longer. And because we have such amazing treatment now, you can go through multiple cycles of recurrence and remission, because they come back and we have newer treatments available. So patients go through these cycles of survivorship and then again in treatment. And what we've seen more and more is that these side effects don't stop at the end of treatment. They and you enter survivorship, the side effects enter survivorship with you, and they tend to linger on for a long time. So our products are such that they take you through treatment and through survivorship, and really sort of reduce the severity of side effects by 70%, 80%, such that you're able to lead a normal life. You're able to do all the things you want to do, go out for dinner, pop one of our xylitol sugar-free candies in your mouth, make saliva, you're able to chew better, you're not embarrassed in a public setting. All of those things matter so much and are so deeply personal, when especially as a cancer survivor or as a patient. So yeah, you can use them through treatment, through survivorship. You don't have to buy two toothpaste. The rest of your family can use it as well. Um, we really wanted to ease that journey throughout your life.
Thank you. And I noticed on the website there's also comfort wear. So, what inspired this creation? And if you don't mind just sharing some about the products.
Absolutely. So, my husband's an oncologist as well. And so, a lot of our conversations are always, he's like, oh, the patient came and, they're, had to wait for the nurse to come in, and, they're uncomfortable, as we examine them. Or if they're undergoing chemotherapy, usually chemotherapy, it's a room, it's a large room. There are about 20 chairs, everybody sitting with their, with the chemotherapy going through their chest port or through a peripheral IV access. um, Not everybody is lucky enough to be in a room by themselves while they're getting chemotherapy. It can be public and can be embarrassing. And also, when you have surgery for cancer, it can be disfiguring, right? You don't feel like your normal self, um, and that can be so bothersome as well. And you don't want everybody to know what you're going through. Sometimes you want to keep things private for a while, just because it's scary, and having to explain things to people is hard. So we had this idea for a while that what can we do to ease that portion of the journey, right? And if you go, you go on Amazon, you go on Etsy, you'll find products. But really, we spent more than 2 years trying to find a fabric that is safe. That's always our priority, is to make sure that it's safe for cancer patients. So for example, our fabric is organic cotton and bamboo. Bamboo itself is thermoregulating, so you don't get very hot in it, you don't get very cold in it. It keeps you at the right temperature. We have it coated with an antimicrobial coating, so it reduces your chances of infection, which is something that all cancer patients worry about, right? Because you are immunosuppressed, so your chances of getting infection are higher. So we coated it with an antimicrobial coating. Our dyes that we used are GOTS certified, meaning they don't impact your endocrine or your hormone response. Sometimes there are chemical dyes that can cause your hormones to go out of whack, and you especially don't want that in breast cancer. So our dyes are GOT certified. Our fabric is the right fabric for cancer patients. And then we are tagless, no tags to irritate your skin. And then the best part is we have all these hidden zippers. So if you wore our set, it would just be like a cord set that's very stylish and comfortable, and you're going about your business. But if you sit in a chemo chair, you could open a zip and access just the port. You don't have to undress. And if you're at a doctor's visit, the doctor can open one of the zips and examine your site, your surgery site, or your cancer site, and you don't have to undress. And you have matching pants. So really, anybody can feel so comfortable as they go through treatment. And really, that was the way we started. And even so we have the matching set for chemo or radiation or whenever you want to go visit your doctor. And then we have the head coverings, right? Because your scalp is affected, especially in breast cancer patients. The chemotherapy causes you to lose your hair, and then the scalp gets very sensitive. So we have this baseball cap that actually covers the entire base of your scalp. So when you put it on, nobody can tell that you don't have hair. And again, it's again lined, double lined with our fabric, very, very soft, very, very soothing, thermoregulating. And then we have a beanie, which actually has an opening in the top that you can't, see. But what happens is that so many breast cancer patients, are put into premature menopause, right? Because of treatment, and you could get hot flashes, and your scalp gets hot, and you're uncomfortable. You can't sleep, and so you can wear this beanie and go to sleep, and because you can have air go in and out, your scalp doesn't get hot and bothered, and your scalp is not rubbing on your pillowcase because you have this head covering, because that is also bothersome. So we have that as well, and then of course we have our port protector pad that you can slip over your seat belt, which protects your port site, and our port protector pad is such that you can take it out, you can wash it, you can put it back on, and we put a silicone coating so it doesn't slip, so you don't have to keep adjusting it. You put it on, you leave it, every time you're in the car it's at the right position for you. Or you can even put it on your crossbody bag as you go, about your day, and again your port site is protected. So those are the products in our comfort wear, and we really, really, we love it. We wear it even just because it's so comfortable to wear. But really, again, very thoughtful, very intentional, and right for both men and women. So we have portraits for men as well, um, and we hope really to ease that portion of the cancer journey.
Wow, I love that. Like you said, a lot of thought and just a lot of care that's gone into that design. And wow, thank you. Thank you. One thing that I know we briefly touched on, but on your website, I know there's some tips, there's some there's some that people can ask. Do you mind just briefly touching on those? What's on there?
Sure. So, we have two things. We have checklists. And this is really because, you're sitting in a doctor's office, and he's giving you or she's giving you all this information, and you don't even know what to ask. And then you remember it at 9 p.m. at night when you're at home, or your caregiver is like, oh my God, like, what are we going to do? Tomorrow's chemo. Did we find out about this? Did we ask? And it's true for everybody. I know so many of my physician friends, right? So just doctors have the same issue. You might be an orthopedic surgeon, and unfortunately you have cancer, and you're like, I don't even know what to eat, I don't know what to wear, I don't know, did I ask about fertility, did I ask about what medications I could be on or not be on. And imagine a regular person who has no medical knowledge, right? So really, they are very practical checklists that you can just take it on your phone. And so when you're sitting in that chair in front of your doctor, say, hey, listen, these are my questions, answer them. You will feel so much better after you go home, because you now have the information you need when your doctor's not around. And the doctor can't be everywhere, right? He or she has tons of other patients looking at. So really, the checklists are a tool in your toolbox that can help you, again, go through treatment much more comfortably. The blogs, on the other hand, I started writing because as a physician, people always call you up and they're like, oh, I have a friend who has this. What do you think about this? Can you look at this? Can you look at this report? Can you look at the scan? Or what should I do about? So really, they're also very, very practical. They're not questions about, what is breast cancer, or what does this PR positive breast cancer mean? Because, those questions your oncologist takes the time to sit with you and explain to you, because he's trying to, or she's trying to tell you what kind of cancer you have and what kind of treatment will work. But apart from that, you know, I just had mastectomy and my site looks angry and red. What should I do? I'm at home and my caregiver is wondering what I should eat, that will help me heal better. So, very practical information that kind of helps you go through treatment when you're not in that cancer treatment chair. The blogs are written for that purpose mainly.
Wow, that's great. And I do love the checklist because I remember just as a nurse sitting in the doctor's office and I felt like it was now this will date probably age myself, but it felt like Charlie Brown's teacher just want, want, want. I had no idea. And I think that's great because your mind just goes when you're sitting there. So that's huge. Well, I want to thank all of you amazing ladies for joining us today and for sharing such valuable information, because I think oral health may not be the first thing people think about when they're facing cancer treatment, but it makes such a huge difference in your comfort, your quality of life. So, thank you for everything Uncancer is doing for the cancer community. And for everybody out there, if you found this episode helpful today, please share it with someone who may need it, and be sure to subscribe so that you don't miss future conversations. For everybody out there, if you have ideas or topics, please email us at info@project31.com. And please visit Uncancer. Please visit their website. Look at everything they're doing for the wonderful, for everybody out there. We love having you on there. Thank you for joining us today on Pink Ribbon Roller Coaster.